Welcome, welkom, wamkelekile. We welcome you all today to this really auspicious occasion. This is a commitment to a profession, to a life of service with humility and integrity. Sawubona, I see you. I see you who have struggled for 6 long years. I see you who have triumphed. Let's all just take a moment to breathe deeply. This has been a long time coming. This has been a long 6 years, and particularly a very long last year. Let's just take a moment just to breathe. This morning's ceremony, as we have explained before, is not a graduation. So whilst we are in our gowns, it is not a graduation. You are not being conferred your degree, which is a university obligation and a wonderful ceremony. Today is an oath-taking ceremony. This is our opportunity to commit. And you have academics amongst you you will be joining as colleagues, and hence they sit with you. We sit with you. We recommit ourselves to the oath yet again and commit to our profession. Because we are under COVID, not able to have the usual kinds of events that we would normally have had, we will be celebrating the prize winners who are in the cohort that you're sitting with. So we'll be doing those in the moment. Because of COVID, as you're aware, we are sitting at distance, but together in spirit. Because of COVID, we will not be asking the prize winners to come forward. We will ask you to stand where you are so that we may acknowledge and celebrate you. And afterwards, we would ask the prize winners to please remain behind so that we can take a photograph with you, with the Dean. But for now, as part of the program with your colleagues, we will simply ask you to stand as we celebrate you. Following the prize winners, we will then enter the formal part of the oath-taking ceremony. We will have recorded inputs due to COVID, because we're wanting to limit the numbers. And we'll be hearing from alumni, community members, and traditional leaders as to what their expectations are of you as you enter the profession today. So we start this wonderful celebration. And in this cohort of students today, we are delighted to announce, and I'm going to ask Professor Lionel Green-Thompson to join me so that we can acknowledge the prize winners this morning. And I'm just going to ask Dominique or Carmen just to give me the prize certificates. All right, and we're going to announce the first. Who actually has 2 prizes today. Can we ask Josh Fegan to stand? Josh Fegan has been awarded the South African Academy of Family Practice Prize for the top student in final year MBChB Family Medicine. He has also been awarded the Family Practice Primary Healthcare Prize for the best student in final year MBChB Primary Healthcare. Congratulations, Josh Fegan. The next prize winner we're going to ask to stand is Rachel Gardner. Rachel has been awarded the South African Society of Psychiatrists Award for the most distinguished final year MBChB student in psychiatry, as well as the class medal for psychiatry, the final year class medal for best overall performance in the psychiatry course. Congratulations. And the last prize winner in this cohort, can we ask Mary Goos to stand, please? Mary, you have been awarded the class medal for obstetrics and gynecology for the final year class medal for best overall performance. In addition, the Cuthbert Crichton Prize for the best student in obstetrics and gynecology in the final MBChB examinations. In addition, the Dowie Dunn Memorial Prize awarded to the best 6th year MBChB student in pediatrics. And in addition, the class medal for pediatrics and child health for the best overall performance in that course. Congratulations, Mary. Congratulations, colleagues, on that tremendous achievement in an incredibly tough year. So hearty congratulations. We're now going to hear from our leading alumni, from our community members and traditional leaders. So please do listen with humility and with compassion, and take on board what it is that these leaders are saying to you as you're about to take the oath. Thank you.
So I remember when I took my oath, I was overwhelmed with a feeling of relief and accomplishment and pride. And the words made perfect sense, but it's only with experience that the words actually take some meaning and really come to life.
As you are taking this oath today, remember, oath is about empathy, professionalism, and care. If you've got those three, you are a winner. Also, oath is about humanity, responsibility of both provider and receiver.
On reflection, the very first line stands out to me, which is I pledge to serve. And so we always need to remember that we are in service of people, not of ourselves, not of money, not of status or societal stereotypes. And we need to serve with integrity and humility.
I really think it's important to actually reflect on the privilege that it is to be a health professional. So many people are trying to apply to get into one of the disciplines at UCT, and for me, you know, it's a massive privilege to actually be sitting here today, or for me to have earned my degree as a physiotherapist. And I think we always have to remember that is a privilege to actually be helping someone through a really difficult time, that it involves one of the most important aspects of their life, their health.
One of the commitments that you'll make is that of lifelong learning. The commitment to lifelong learning means using the current period that we're going through as an example, is that you see that there's a rapid change in new knowledge, new diseases, and new health challenges. And as a health professional, you must always be at the forefront of research, information, new technology, to be able to respond appropriately.
As a newcomer into the health system, you may often feel that you can't change much. As a group of interns, we were able to notice that one of our wards in a rural hospital really needed touch-ups. It was a children's ward that was quite plain, but we worked together with local businesses, with colleagues, to ensure that we transformed it into a child-friendly ward. This does illustrate that coming with new eyes, you would and are able to change things for the better within the health system.
Working with an underprivileged team and providing the coaches with skills or the athletes with skills to enhance their abilities is amazing. And I think that's the important thing within South Africa, is that yes, we might not have the resources, for every team might not be equal and every hospital might not be equal, but we have so much skill and knowledge as health professionals that it's so easy to actually teach another person.
As a health professional in South Africa, and given the inequalities in our societies, I think it's particularly important for health professionals to be mindful of those inequalities, to do their bits in terms of addressing those inequalities. And that will require us working not only across our disciplines in the health professions, but with other sectors, working intersectorally to make sure that we address the challenges of our societies in a comprehensive manner.
So the oath has guided my daily practice, and I noticed this in my second month of internship when one of the matrons came to me and asked which university do I come from. So I thought I did something wrong and said UCT. But what transpired actually has stuck with me for many months. So she noticed that there was something different in the way in which I interacted with the nurses, the porters, the patient, and she really wanted to compliment that. That was surprising because I thought I was doing what you should be doing, but she had noticed that as something extraordinary. So many of you will get into the service and think you're doing the normal, but that turns out to be the extraordinary because of the type of education you've received and the type of training that you've received.
And one needs to embrace the good times, but learn from the difficult times, and also look after yourselves amidst all of that, and recognize that you have immense power as a healthcare professional to be a voice for your patients, to uphold their human rights, to serve them, and as cliched as it may sound, to make the world a better place.
It is very important that the student must reflect on their work that they are doing within our communities, especially the marginalized community and vulnerable one. We need to hear the voices of our gogos, meaning our elderly people who are always standing in those queues at the clinic. We need to hear the voices of our own sisters who are domestic violence abuse. Go out there and be advocates for a change.
My message to students is to always remember what a resilient group they are. They are the group that saw the Fees Must Fall movement. They have just survived a pandemic. These are graduates who are going to be able to change the face of South Africa, the face of the health system in the country. And I think whenever it gets tough, every single graduate should remember that they have gone through the most and they will still survive.
I really do feel that these challenges have made the class more resilient, more mature, and more capable. And I really look forward to this new generation of more socially responsive and compassionate healthcare professionals.
To the class of 2020, you deserve a massive congratulations.
To you, I say that you've conquered, you've made it this far, and I know that South Africa is going to be a better place because of you. Go well and make us proud.
Congratulations on a remarkable achievement under extremely difficult circumstances. I have true confidence that you will be fantastic healthcare professionals for the communities that you work for. I wish you every joy and success as you embark on this noble and rewarding profession. Much love. God bless.
I would like to congratulate you for a journey well traveled. You have really surmounted many challenges, and we look forward to welcoming you into the health system.
A good luck for your future, and be the lamp wherever you go. Shine. Sithi isiXhosa, ndingantaka baba uvula amaphiko uwatweze, meaning fly eagle, fly higher and spread the wings. All the best to you. Halala. Enkosi.
Sawubona. Somebody's got to respond to that. Sawubona. Mangithi sawubona ngithi ngiyakubona. And namhlanje siyakubonela ngempela ngoba sinifikile. In many ways, when we say sawubona in our regular conversations, it's become passé. We don't recognize that we are seeing people. And so in a very special way today, I want to declare again that we see you. And I didn't plan this with Dr. Beg, so I'm quite surprised that we've chosen a similar connection of what we've said. I want to say a couple of things before we do the oath itself. And we're just waiting for a picture. So yesterday, and I think what we've tried to do with the ceremony is to say to you, to hear the many voices of the people who will come to you in your various spaces, in your positions of power. Because one of the things that you will recognize as you leave here is just how much power you have over patients. over those who come to you. In a study I did some time ago, the comment was made that there is no other person who has the power to tell a person, an 82-year-old woman often, to strip down to their underwear. And you will have that power. And so you need to treat it with a deep sense of respect. So yesterday, the deanery invited a group of the representatives of the original peoples of this land, the Khoi Khoi. Because in fact, things I didn't know I've learned in the last couple of days, that the Khoi Khoi in fact existed in exactly this space. Kamiloni is the name of observatory in the language of the First Peoples. And it means place of the stars. And for me, in many ways, it's not an accident that the healing learning happens on this mountain, which in fact, that First Peoples regarded as their place of healing too. And so we brought them onto the campus to, in many ways, do some kind of cleansing of the space because we've had a tough year. And I don't know that we want another one like it. So in many ways, to cleanse the space in the traditions that they had, and then to give a blessing on you. And so they touched us, some of the members of the faculty, really as a symbol of touching you and sending you out into the various communities that you will engage. But I want to greet the staff who've agreed to sit amongst you today. Because for me, and those of you who have been in meetings with me will see that I call you colleagues from my first encounter with you. Because when you enter these professions, you become our colleagues. And over time, you develop into different kinds of people, but we hope into more serious professionals as you grow. So I want to acknowledge them and the contributions that they have made over this year. I'm not always sure that I understand even the kinds of sacrifices that people have made. But I'm reminded of that when in a meeting at 7 o'clock in the evening, somebody's child crawls across the screen and says it's time for food. And that gave me a sense through this year of the extent of the sacrifice that the teachers have made. But I want to return to this idea of Sawubona, I see you. Because I see in you the naive young matriculant to travel to the Cape from far and wide, uncertain of what lay ahead. For some of you, it was the first time that somebody was going to university. For others of you, it was just part of your family's tradition. It's the things that your family did. Sawubona, I see you in the mixed encounters of leadership that you have had over these past years, and the many encounters of learning encounters which filled you with knowing, but often brought some pain before the glory could be experienced. Sawubona, I see you in this fulfillment of the promises which were started in you when your parents named you, when your village celebrated your capacity to learn. Sawubona, I see you. I see you as a reflection of who we are as a faculty. These last years, and for this class particularly, you've had a stormy time since you arrived 6 years ago. These last years have been a storm which raged against the very foundations of who we are as a faculty. And you have come into that storm, but today you take your place in the tapestry which is the legacy of this faculty. I also see in you people who now emerge here at the confluence of our legacy as a faculty and the promise that our faculty makes to make our nation healthier. Because you've become the epitome of our commitment to the people of South Africa. Your promise is about to play itself out in the context of competing pandemics. The ongoing gender-based violence pandemic, which will soon be a regular part of your work, and yet it will rely so heavily on you to make the encounter with patients more important than your frustration with the system. And you will be frustrated. But every time you encounter a patient, they must know that the time they spent with you is different. And it's very frustrating, let me tell you, at midnight when somebody drunk comes in the door. But I want to speak as well to something your own colleagues have said, and I think one of them is in your class. Majid Bowden, Kamua, and Salduka wrote a piece in the Daily Maverick earlier this year where they spoke about social justice for health professionals. And they spoke about how, as we become aware of our occupations and this notion of everyday doing, which is what you will be doing as you go forward, that we must be able to resist and oppose ideas and systems that oppress our communities. Repeatedly, you may be the only encounter with dignity your patients experience in the health system. Make it count. That's what today is about, really, is about making those individual dignity moments count. Today we mark World AIDS Day, and it's probably fortuitous that you should take this oath on a day like this, because there's nothing like the AIDS pandemic which has demonstrated to us the journey through stigma into acceptance, through pain and alienation, through a place where people who mark themselves with AIDS can take a place in our society quite proudly. But you're also making this commitment at a time where more is going to be asked of you because you enter into the system at a time of pandemic. In the last couple of days, some of you may be watching with concern the rise in the numbers in the hospitals you will be going to, that you will arrive in 4 weeks' time at. And I want you to go with the strength of the faculty into the fray. And I want to say to you, as I did to the third years, we had a bit of a battle with the third years in the course of this week, that the things that you do are more likely to give you COVID than the things you do with patients. And I think that's the kind of spirit which I'm encouraging you to enter into this work with. That the things we do in our social spaces, our keeping our distance, our ensuring that we've got a mask on, and that we avoid massive gatherings, all of those things speak more powerfully to how we control this virus. But I want to make the emphasis today about this oath-taking because you will have seen in our communications earlier that it's less about your individual celebration today. And there's no doubt it's a celebration. It's more about the promises we make. And these promises have their history in ancient traditions. I mean, I don't know if anybody read the book Cutting for Stone. And cutting for stone, the phrase cutting for stone comes out of the original Hippocratic oath. And it was, don't cut for stone, because that was regarded as a futile procedure. So already in the times of Hippocrates, there was this tension about how the health professionals engaged with the society that they were in. But today's oath-taking marks a translation for us of the legacy. It translates the legacy that you have of the health professions over the centuries into a promise to the people who you will encounter in their deep vulnerability. Even as we look back to Hippocrates as the origin of this oath, we've converted it into modern words so that you can mean the things that you say. And so I'm going to ask the gathering today. So one of the things that I want to do today is that when I say, I will say I with my name, and I ask you to respond I with your name. Because unless you declare yourself to be in this oath, it may not mean anything to you. It becomes a bit of a thing that we do together. So I'm going to ask the congregation to stand as you begin the process of taking this oath. Can I take this off? I, Lionel Green Thompson, I solemnly pledge to serve humanity. My most important considerations will be the health of patients and the health of their communities. I will not permit considerations of age, gender, race, religion, ethnic origin, sexual orientation, disease, disability, or any other factor to adversely affect the care I give to patients.
I will not permit considerations of age, gender, race, religion, ethnic origin, sexual orientation,
I will uphold human rights and civil liberties to advance health, even under threat.
I will uphold human rights and civil liberties to advance health, even under threat.
I will engage patients and colleagues as partners in healthcare. I will practice my profession with conscience and dignity. I will respect the confidentiality of patients, present and past, living or deceased.
I will respect the confidentiality of patients, present or past, living or deceased.
I will value research and will be guided in its conduct by the highest ethical standards.
I will value research and will be guided in its conduct by the highest ethical standards.
I commit myself to lifelong learning. I make these promises solemnly, freely, and upon my honor. Thank you. Please take this moment to sign the oath now and to keep it for yourselves as your commitment to remain true to the promise. I realize not many people are carrying pens. It's the nature of this time. But thank you very much, and thanks to Dr. Begg for putting this together.
Thank you, colleagues, and to you all, welcome, colleagues, to the profession. We wish you strength and courage as you forge the path ahead. May you listen with compassion, walk with humility, and act with justice. Please stay seated as the ushers escort you out row by row. Thank you, colleagues. Wishing you everything of the best for the year ahead.